Hello, sir.
Yes, ma'am.
Shall we start the class?
Yes, ma'am. I'm ready, ma'am. No issues.
Yeah, okay. Sir,
Yes, ma'am.
shall we start?
Yes, ma'am. We can start. Good evening, back. Welcome to Oracle. Today is our second class on demography and family planning. Welcome to 90 Days University Professional Free Final Mastery course. And today we'll be discussing on rapid revision of all the important questions with quick facts and high yield topics, and the most important questions which will be asked for your exams. Today we'll be discussing about the various methods of contraceptive and used what are these methods used in family planning. And in short essays, we'll be having 4 questions, that is salient features of national population policy and intrauterine device ideal candidate advantages, contraindications and side effects, and what are the national family planning methods. And the last question is net reproductivity rate. Okay. Oracle offers you 5 modes of learning, that is recorded classes, live classes, practical sessions, exam modules, and hard copy book sets. We have recorded classes, which gives you very foundational classes, flexible in learning, convenient revising whenever you want, wherever you go. And it provides a very good step up for success, and it also gives you the answer writing skills. Okay. In live classes, we have in-depth coverage of 10 years previous year question papers, and most expected questions will be discussed. And in interactive learning, we'll be having doubt clearance, MCQ polls, and Viva OC, and many more. In Express module, we have coverage of complete syllabus in 20 hours, and you'll be exposed to answer writing skills, where you'll be getting your diagrams, flowcharts, or effective answer writing skills by our expert educators. And we'll be having one-to-one doubts clearing session also, where it will be student friendly. You can ask any question any number of times you want, and you'll be in the safe learning environment, and you'll be given the personalized attention for each and everyone. And we'll be providing you the hard copy book sets, where you can learn and revise your exams for your exams whenever you want to, whenever you get bored of, or whenever you have a high strain of looking at the screen, you can take it through the hard copy also. And we'll be giving you a question bank, which is 3 levels of expertise, which is from beginner to expert level, and it is customized for exam preparedness. And it covers all the exams for prof exams, NEET PG, and FMGE exams. And we'll be giving you practical sessions where you can go and face your examiner in the practicals exams and viva voce with very much confidence. With all this, we have 4 plans for all these things. That is foundation plans at 19,999 and advanced learning plan for 6 months at 32,999 and complete learning plan for 59,999 and ultimate MBBS plan for 1,90,000 only. And do not forget, you will be having a code displayed below for discounts. You will be getting a very good discounts. Please do use the code below, which is there for subscriptions. With this, we'll be starting our first class. That is, we'll start with the case scenario. The Sharma family. The Sharma family lives in a small town in India. Raj and Priya Sharma are 30 years and both are 30 years old and have been married for 5 years. They have 2 children. One is 4 years old and 2 years old. And Raj is also a school teacher and Priya is a nurse at local hospital. The situation is they're planning to have a third child, whether they should have it or not, and ensure they can provide the best possible future for the children and including good education, healthcare, and comfortable living. They also want to balance their work and personal lives effectively. This is the situation. And you will be asked to discuss should they go for the third child or should they use any contraceptive method, or you can analyze the situation that the first child is 4 years old and second child is 2 years old. Is there appropriate spacing method between those two? Was there any contraceptive used? Were they given any contraceptive education? All these things can be discussed in your case scenarios during your viva exams. With this, we'll be starting with long answers. All the questions which are there in this case scenario will be answered in the future next questions. Okay. Discuss the various contraceptive methods for family planning. This is the question for today. We'll start with the introduction. Family planning is to regulate the number and spacing of children in a family through practice of contraception or other methods of birth control. What is the family planning requirement? To regulate the number and spacing of children in the family by any method of contraception and methods of birth control. And we do have a definition for this. It is a way of thinking and living that is adopted voluntarily. Voluntarily is the important word. Way of thinking and living adopted voluntarily. It is not forced. Based on knowledge, attitudes, and responsible decisions by individuals and couples. In order to what? Promote health and family welfare of family group. Thus, contribute effectively to social development of a country so that they're not burden on a country. Okay. This is the definition. Please do remember. What is the purpose? The definition has everything. Raising a child requires significant amount of resources, time, money, and environmental and social resources. Okay. Too many children, you can't provide all the resources. Planning can help to assure that resources are available for the particular child and to improve the health of the mother and the child and to prevent this, that is HIV and AIDS. Criteria for ideal contraceptive: it should be safe for use, means free from any kind of side effects, and it should be reliable. That means there should be less failure rates, easy to administer and convenient, and it should be cost effective. It should not cost you around, when the person income itself is 50,000 per month, it should not cost around 10,000 per month. It is not cost effective. Okay. It should be culturally feasible and acceptable by the couple. Both, that is both couple. If it is a male contraceptive method, it should be accepted by the male, and if it is a female contraceptive, it should be accepted by the female in a cultural way. What are the methods of contraception available? There are two broad classifications, that is spacing methods and terminal methods. What does spacing methods mean? Spacing methods mean there is one child and you want to extend the space, the time duration, that space is the time duration from the second one. First child is already there and you want to plan for the second child, and to increase this time is called the spacing method. Okay. And if first one is the abortion, should we go for the second one immediately after 3 months? Again, the contraceptive should be used to improve the health of the mother. Okay. And terminal methods are permanent methods. These are temporary methods. These are permanent methods. Under spacing methods, we have natural methods, barrier method, intrauterine devices, hormonal method, post-conceptional method, and miscellaneous other types. Okay, we'll look at one by one. Spacing methods. It helps prevention of pregnancy as long as they are used. Okay, for what they're used? Timing and spacing of pregnancies, preventing unwanted children, and these are temporary methods. Temporary methods used for timing and spacing of children. Under spacing methods, we have the first one, that is natural methods. Natural methods, they do not involve use of any man-made devices or artificial ones. Okay. And these methods are useful for timing and spacing of pregnancies. What is that? Abstinence. Abstinence, that is complete avoidance of sexual intercourse, which is very difficult in married couple. Okay. You need a very strong will, moral will, or a strong willpower to do this. Coitus interruptus or withdrawal method. In this method, the penis is withdrawn in vagina before ejaculation so that the semen is prevented from entering the uterine cavity and pregnancy does not take place. Again, this is the difficult method, and you individual needs what? Great deal of self-control, as the failure rate is very high. Slightest delay can lead to failure. Merits are, it is low cost, involves actually no cost, it does not require any other device, it is only self-control and discipline, which is very difficult. Okay. Next, we have safe period. Abstinence is over, withdrawal method is over, in the safe period. Based on the process of ovulation and menstrual cycle, which helps the determination of the safe period. Okay. It does not require any man-made device. It requires self-control by partners during the unsafe period. Not suitable for women who are having high, does not have regular periods. That means if someone's cycles are irregular, it does not make any effect on them. And failure rate is high. It also requires great deal of willpower and motivation. Okay. Safe periods are this, that is first day of, and this. Okay. From 11th day till 22nd day are called as unsafe periods because ovulation is taking place. This is safe time, that is safe period or calendar method. It is also called as calendar method. Next, we have barrier methods. Natural methods is over. We'll be discussing natural methods again. Now we'll be looking at barrier methods. That means there is a barrier preventing meeting of sperms with the egg. Okay. There are many major types of barrier methods. We'll look at one by one. Physical barrier method, that is using of condom. It is a thin latex rubber. Okay. Rolled over the erect penis before having intercourse, and it prevents the entry of semen into the vagina. The condom must be held carefully when taking out of from the vagina to prevent the spilling. Okay, and it is available free of cost from urban and rural family welfare centers. It is provided by the government for free of cost. What are the merits? It is most simple and effective method, easy to use, disposable, no medical supervision is required, and it protects from sexually transmitted disease also. This is one of the important aspect. Demerits, if it is not used correctly, then there might be a tear or slip, and some rare cases there may be allergic to the latex rubber, and some people may not enjoy. This is the only demerits. Otherwise, it is a very good method. There is a female condom also, which is known as diaphragm. Okay, used by women in to is like it looks like a dome shaped or a shallow cap. Okay, this is the shallow cap or a dome shaped, also known as Dutch cap. It is made up of soft synthetic rubber and plastic. Okay, it is available in various sizes, starts from 5 to 10 centimeters. It is held in the position covering the cervical opening by the tension of the rubber and partly by the tension of muscle. Okay, it is very important to observe the vaginal muscle tone before inserting it. What are the merits and demerits of this? It is effective, very effective if the spermicide is used with this. Failure rate is low and no risk or any contraindication. It requires the assistance of doctor to insert it or to demonstrate it. It requires privacy and time to place it in, and it requires periodical checkup so that it is not displaced. It requires facilities for its proper care and storage, like a separate private area to storage so that no one else will handle it. There's something called vaginal sponge. It is a polyurethane foam sponge. It has a spermicide known as non-oxynol, which is a spermicide. It is shaped in that way it can fill the whole cervix and has a loop on outer surface which can be pulled out of the sponge after use. Okay, should be inserted before the coitus, provides protection for 24 hours. It should remain there for at least 6 hours after coitus. These sperms are trapped in the sponge and are destroyed because of the non-oxynol 9. Okay, it is better than not to use any method. If this is used, not to use any method. Okay, there are demerits also. The demerits is it has to stay for 6 hours after intercourse. It should be inserted before the coitus, before the intercourse, and it provides protection for 24 hours. If it is left more than 6 hours, there is something called toxic shock syndrome. There might be a complication of this, which is very grave and very dangerous. Okay. Coming to the chemical barrier methods, these methods usually kills the sperms, and this way chemical contraceptives help in preventing the pregnancy. Okay. We have seen the physical barrier methods which prevent the meeting of sperm and ovum. Okay, but these kill the sperms. They are foams, aerosols, creams, jellies, paste tubes from a tube, suppositories, and soluble films. What are the merits of this? Usually they are non-oxynol line, easy to administer, available everywhere, not very expensive, but high failure rate because of the dosage used. Has to be inserted deep down. Must be applied before intercourse. It may cause irritation and burning in the vagina. These are the major demerits of chemical barriers. With this, there is one more, that is intrauterine devices. Now, the egg and sperm have met, they have formed the zygote. Now, you don't allow this zygote to get implanted. This is the function of intrauterine device. Okay, these are placed in the uterine cavity. They're in earlier age it was made of silkworm, gut, silk, or gold. There are three different of IUDs: first generation, second generation, third generation. First generation were non-medicated, just simple ones. Later, copper was introduced, and in third generation, hormone-releasing IUDs were found. We'll see all the three generations. First generation, the devices were made of polyethylene and no medication, no hormones. It looked like somewhat like a snake, like this. Lipless loop. It is called as lipless loop, made up of polyethylene, sometimes contain barium sulfate, which made so that whenever the X-ray is done, someone could identify where it is. If it is getting missed or it is turning the, rupturing the uterus, it could have gone into the peritoneal cavity or abdominal cavity so that it could be traced out where it is. And it had through two threads in the end, fine nylon threads to remove it. Okay. And then came the second generation intrauterine devices. They were made of polyethylene. Same polyethylene was used, but copper was added onto it. Okay, why? The metallic cap copper had a strong anti-fertility effect. And commercially available devices are, first we had copper 7 and T200. Later we had copper T220 and 380 alpha, that is 380A. Later we had multi-load devices, that is multi-load 250 and multi-load copper 375 and Nova T. All copper devices are more effective and there were less chances of side effects, that is pain and bleeding. We look at the advantages. It was very simple. No complex procedures were involved. No hospitalization, but OPD process. It was completely OPD process. Okay. Insertion took only few minutes. Once inserted, it gave cover for a very long period, inexpensive in nature. So it was affordable. Contraceptive was completely reversible. Okay. Reversible effect was there. And acceptance rate was good and hence the continuation rate was good. And there's no need for continued motivation like use of, if you are someone is using physical barrier or chemical barrier, they should motivate. The healthcare worker would have motivated, please take this to prevent the pregnancy, but here there is no requirement at all. Okay, only single act of motivation. Once you motivate them and put it inside, it would give a coverage for very good period. Third generation were Progestasert and LNG 20. Progestasert is a T-shaped 38 mg progesterone device and it contained the natural hormone, and 65 micrograms of progesterone is released slowly into the uterus. Whereas levonorgestrel 20, it had 20 micrograms of levonorgestrel, a synthetic steroid. Okay, it is also T-shaped IUD. What were the contraindications for introducing, for adopting a intrauterine contraceptive device? Absolute one was if there is any suspected of pregnancy, delayed periods, or if any urine pregnancy test was positive. Presence of inflammation or signs of pelvic inflammatory disease, vaginal bleeding, or if there is any bleeding which you cannot diagnose, and complete oncogenic process of the cervix, uterus, and other pelvic tumors, and previous history of ectopic pregnancy. And ectopic pregnancy itself is a side effect of copper T. And if there is any previous history of ectopic pregnancy, again it is a wrong one. Relatively, there was anemia, menorrhagia, history of pelvic inflammatory disease in the sense last pregnancy, and again purulent cervical discharge is there, that is any infections, distortions of the uterine cavity due to congenital malformation of fibroids, and if the person is not interested, obviously will not give it. Who is the ideal candidate for copper T or a IUD? A person who has at least one child, no history of pelvic disease, has normal cycles, willing to check the IUD tail regularly, has access to healthcare facility and treatment of potential problems if any is there, and if someone is in monogamous relationship. If someone is in polygamous relationship, please do not advise IUD. Okay, the infection rate will be high and there might be other complications also. What are the side effects and complications? Bleeding, pain, pelvic infection, uterine perforation, pregnancy, ectopic pregnancy, expulsion, fertility after removal, cancer teratogenesis as mortality. Mortality because of this or this if it is untreated. Now we have tablets to prevent. We were intervening at the local level. Now we will intervene at the systemic level. We have hormonal contraceptives. These work when it is properly given, they are very effective. Okay. If it is combined with any other, then it is 100% effective. We have two steroids, that is gonadal steroids, estrogens and progestrogens. Okay. Estrogens we have, progesterones we have megestrol, medroxyprogesterone acetate, and estrogens we have norethestone acetate, lanestrol, norethestone acetate, ethinodiol diacetate, and norethinodrol. And we have gonans also, that is levonorgestrel. There are two types which are available. One is oral and one it is depot formulations, that is Local, you inject them and they will keep on releasing slowly. Under oral pills, we have combined pill, progesterone only pill, post-coital pill, once a month pill, and male pill. Okay. In injectables, whether it is subcutaneous implants or local or injectables, that is under the muzzle also. Combined pill, there it is composed of two hormones, that is estrogen and progesterone. Okay, in very small doses. Two types are available, that is Mala N and Mala D. What does Mala N contain? It contains D-norgestrol of 1 mg and ethinyl estradiol of 0.03 mg. And Mala N contains norethistérone of 0.5 mg and ethinyl estradiol of 0.04 mg. Okay. Sorry for this mistake. This was not supposed to be there. Okay. Mala D contains 28 pills. Okay. For 28-day cycle. And 21 of oral contraceptives and 7 brown film coated pills, that is iron tablet, whereas fumarate of 60 mg. And it is cost of the per strip is around 3 rupees. Malayan was supplied free of cost by the government of India. And the next one we have is progesterone only pill. It is also called as mini or micro pill. It contains only progesterone. Given in cycle, in small doses throughout the cycle. Okay. Complete 28-day cycle. Commonly used are norethistérone, levonorgestrel. Okay. These are all given completely during the cycle. Now we have what we do if there is a contraception and someone wants to prevent the pregnancy. Okay. Post-coital contraception recommended within 72 hours of unprotected intercourse. Two methods. Either you put a IUD within 5 days or use hormonal methods, that is levonorgestrel of 0.75 mg is used for emergency contraception. How? 0.75 mg within 72 hours of unprotected sex and second tablet after 12 hours of first dose. Okay, within 72 hours after 12 hours. This is one, and otherwise there is no levonorgestrel available. Two oral contraceptive pills of 50 micrograms of ethinyl estradiol within 72 hours and repeat after 12 hours. Or 4 oral contraceptive pills of 30 to 35 micrograms of ethinyl estradiol within 72 hours and 4 after 12 hours. Or mifepristone 10 mg within 72 hours. Everything is done within 72 hours. The first dose is done within 72 hours and the second dose is done after 12 hours in levonorgestrel and 50 mcg of ethinyl estradiol and after 4 hours in case of 30 microgram dose. Okay. Postcoital is of two types. One is intrauterine device, the other one is hormone. There's something called once a long pill, once a month pill that is long acting. It is quinastrol is the drug. It is a long acting estrogen given in combination with short acting progesterone. Since it is a once given a month, the pregnancy rate to be is too high to be acceptable and it cannot be used in females with irregular menstrual cycles. Okay, and as a side effect, it also causes irregular menstrual cycles. There is a male pill also. What is the approach of male pill to prevent spermatogenesis, interfering with the sperm, that is complete cycle, and storage and maturation of the sperm, again interference, preventing sperm transport in vas. These are the approaches for male pill. What are these defects? We'll see. Risk and benefits of hormonal pills. This is the risk and benefits of oral contraceptives, not the male pill. Okay, risk and benefits of OCPs. Cardiovascular, this is increased risk of hypertension, venous thrombosis, MI, cerebral thrombosis, carcinosis, again risk cancer, cervical cancer risk is increased. Metabolic effects, raised blood pressure, high density lipoproteins decreased, blood clotting, and elevated blood glucose, further leading to diabetes. There is liver disorders also, hepatocellular adenoma as well as cholestatic jaundice. There might be lactation, ectopic pregnancy, breast tenderness, weight gain, headache, and bleeding disturbances. These are the adverse effects. There are beneficial effects of the OCPs. Benign breast cancers, including fibroid cystic disease and fibroadenoma, came down. Okay, ovarian cysts came down. Reduction in iron deficiency anemia. Reduction in risk of pelvic inflammatory disease, risk of ectopic pregnancy, and decreased risk of ovarian cancer. Okay, these are the 6 benefits and of OCPs. Now I'll go to the depot formulations, injectable subdermal implants, and vaginal ring. Sorry for the spelling mistake again. Injectable contraceptives are of 2 types. That is depot metroxyprogesterone acetate and norethindrone enanti. This is E. Okay. Both of these contain synthetic progesterone, which prevents ovulation. DMPA is, we'll see how it is given. DMPA is given intramuscular injection, 150 mg every 3rd month. Okay, it is also very good. Like you have to get it done once in 3 months. Effect is by suppression of ovulation. If 200 mg is, if one instead of 150 mg, you can give 104 mg subcutaneous once in 3 months. That is DMP and DMPSC. Norethindrone enantate, it is given 200 mg IM every 6th month. Okay, when is it given? Both are given 5 days, first 5 days, during the first 5 days of menstrual period. Otherwise, it will not have any effect. Okay. Next, we have post-conceptional methods. How? We have post-conceptional contraception, that is by giving drugs to prevent the pregnancy. Now, post-conceptional methods means that you are doing something to evacuate the contents of pregnancy, which is very dangerous. So it involves considerable risk. One is menstrual regulation, that is aspiration of the uterine contents 6 to 14 days after a missed period. Okay, but before this, you must get a pregnancy done. If you don't get the pregnancy done, if there is a missed period, it could be because of so many reasons also. There could be PCOS, which will cause delay in pregnancy, or some other reasons, and it will cause other complications. Cervical dilation is indicated only in nullipara, not in multipara. Okay, and menstrual induction by medications, that is progesterones. Okay, that is called as withdrawal bleeding. Okay, and oral abortifacient using mifepristone, that is RU486, in combination with misoprostol, is 95% successful for terminating pregnancies up to 9 weeks. Okay, the last one is abortion with proper guidance of the doctor and the approval of the medical officers. Then we have the sterilized terminal methods, that is end of the matter types, which will give you long-term effect till the family survives. That is male sterilization, vasectomy, very simpler, faster, and less expensive. Not much of cost is involved, and the patient should be told that he is not sterile immediately after the surgery. At least 30 ejaculations may be necessary before the seminal examination is negative. Otherwise, the failure rate is still high. And female sterilization, again, it is tubectomy, either done by either laparoscopy or mini lab. Okay, these are the 2. Who does it? Medical officer or gynecologist done it. Who is the medical officer? Trained medical officer does it. Okay, and there are incentives are being provided with male sterilization also for vasectomy. It is a very simple process and very effective process also, if it is followed in a right way. Next, we have short answers. We have around 4 short answers for today. That is, salient features of national population policy is the first short answer. There are around 14 points in this. if it is asked for 3 marker, short answer 3 marker, please do write at least 6 or 7 points. Okay, we'll look at into the points. It is very easy to remember. Okay, the first point is to reap the most significant advantages of reproductive health services. We have health services, that is RCH program, RMNCH plus, everything, to reap the advantages of them. Okay, which promotes educated voluntary decision making and public acceptance. Okay, and national population policy ensures education free and mandatory for all children till the age of 15. Okay, what does it help in? Education and mandatory of education helps in bringing down the mortality and increasing the literacy rate. And the third salient feature is reducing the infant mortality rate, that is less than 30 per thousand live births, and reducing the maternal mortality rate to less than 100 per 10,000 live births. Okay. First one is RCH. RCH contains, there are so many services which are provided under RCH. So National Population Policy says extract the significant advantages of the reproductive health services, which is promotive, educative, decision making, publicly acceptable, everything. With this, you give the education for all the children, which is free of cost and mandatory till the age of 14. Okay, and children are involved, so reduce the infant mortality rate to 30 per thousand live births, maternal mortality rate to less than 100 per 10,000 live births. Now the children are there. Children, what do they require? They require immunization. So achieve 100% vaccination in all infants against the illnesses that can be prevented by vaccination. Okay. Encourage females to postpone marriage, preferably before, sorry, it is after and about 20 years. Okay. And it is achieving, how does it achieve? Sorry, there's one point here, which is maternal mortality rate. How do we reduce the maternal mortality rate? By conducting 100% qualified individual deliveries and institutional deliveries, and achieving 100% of records. Whatever the births and deaths are there, those should be recorded. Next, provide services for regulating fertility and contraception, and reducing AIDS transmission and fostering improved communication between RTI and, that is reproductive tract infections, NACO, and AIDS control organization. Okay, so that communicable diseases are prevented. With this, there is Ayush healthcare integrate with the Indian system of medicine. Okay, promote them preferentially for limited families, and all social welfare programs of that family planning and assistance should be focused on needs of the individual. This answer is very simple to write. National population policy focuses on mother and child. Okay, for mother, when she gets pregnant, before getting pregnant, for a female, give the education till 14 years, which is free of cost. Okay, for all the children. Once the female gets married, increase the age of married, not less than 18, and preferably about 20. Okay, once they get married, see that they undergo in institutional deliveries and or a delivery by skilled attendant, 100% or 80% institutional delivery. Once they deliver, see that the maternal mortality does not happen and infant mortality does not happen. Once this is taken care of, the child, see that it gets immunized properly. Okay, once after all this done, see that all these events are recorded completely, 100% achievement of recording. Okay, once the child is born, again regulate the fertility for contraception and spacing. And what is the other factor in this? That is contraction of AIDS. That should be prevented. If you remember all this in a cycle, it will be easy for you to write this national population policy. Okay. Next, we have the repetition of the question, that is intrauterine device, ideal candidate, advantages, contraindications, and side effects. Who is the ideal candidate for intrauterine device application? At least one child should be there. No history of pelvic disease, that is, no history of any pelvic inflammatory disorders, and has normal menstrual cycles, is willing to check the IUD tail, and who has access to healthcare facility nearby, and in monogamous relationship. These are the 6 points which are compulsory to remember. One child, no history of pelvic disease, regular cycles, willing to check the IUD tail, and access to healthcare, and who is in a monogamous relationship. What are the advantages of IUCD? It is very simple to use, no complex procedures required to be done, OPD procedure, no hospitalization is required, insertion is done in matter of few minutes. Once inserted, it is gives a protective cover, fertility protective cover for a longer time, not so expensive, very affordable, and effect of contraception is reversible, and highest continuation rate. There's no need for motivating the individual again and again. You motivate once and put it inside, it is done. Okay. 2 points in every heading, you will be getting your complete marks. Okay. Ideal candidate, advantages, contraindications, and side effects. 2 points gives you 8 points so that you can complete your answer. Coming to the contraindications, again, broad classifications, absolute and relative. Absolute contraindication, if you're suspecting pregnancy, do not use it. Pelvic inflammatory disease history, vaginal bleeding of undiagnosed etiology when you don't know, cancer of cervix, uterus, or any adnexia or other pelvic disorders, history of previous ectopic pregnancy, do not go for IUCD. Relative, if the individual is having anemia, history of menorrhagia, history of PID, cervical infections or vaginal infections, distortions of uterine cavity or malformation, retroverted uterus, and person who is not interested are the relative contraindications. Coming to the side effects and complications, normal bleeding is one of the major complication. Pain, again, while inserting there might be some pain. Pelvic infection, if it is done in a unhygienic way or a improper way. Uterine perforation, if too much of pressure is applied and if it is done by the untrained person. It should be done by a medical officer, not by the birth attendant or the staff nurse. Pregnancy, which is one of the failure but very low. If pregnancy is there, most commonly it could be ectopic pregnancy because of the non-availability of space. Expulsion, no, because of the laxity of cervical loss. Fertility after removal, it can happen immediately or later. Cancer teratogenesis, very unlikely or rare. And mortality, it can happen because of either uterine perforation or rupture of ectopic pregnancy if they go unnoticed or untreated. Okay, these are the most side effects, common side effects and complications. Rare ones are for the same. Teratogenesis, fertility after removal, and mortality are the rare ones if they happen only if things are not treated on time. We have the natural family planning methods. What are the natural family planning methods? Okay. In this, we'll be discussing the something else which is not discussed in the first question. We have 3 types of methods. That is basal body temperature method, cervical mucus method, and symptothermic method. In all these methods, women should self-recognize what is happening with her or with her body. These are the physiological signs and symptoms which are associated with ovulation to ascertain when the fertile period begins. the change of body temperature, change of mood, all these things happen. Okay. What is the importance of this? This importance is to avoid using contraceptives, that is oral or chemical or anything, and contraceptive devices, that is to avoid the artificial ones. Okay. First, we'll discuss about basal body temperature. Basal body temperature depends on the identification of specific physiological event. What is the specific physiological event in the body? Raise of body temperature, basal body temperature at the time of ovulation. Okay. Why does there is a rise of temperature? Increase in temperature increases because of production of progesterone increases immediately after ovulation. Okay. And the rise of temperature is not 1 or 2 degrees, it is hardly 0.5 to 0.3 to 0.5. Okay. If there is no ovulation, the body temperature does not rise. When does it happen? After menarche and during lactation. And the temperature is measured preferably before getting out in the bed in the morning. Before coming out of the bed in the morning, it is measured. It is reliable. Okay. If the intercourse is restricted to the post-ovulatory infertile period, that means the body temperature should be monitored daily. Okay. The major drawback is abstinence is necessary during the pre-ovulatory period, not just the ovulatory period, including the pre-ovulatory period is also required, because if there is deposition of sperms and later there's release of ovum, there might be a chances of fertilization. That is one of the drawback. Cervical mucus method, it is also called as Billings method or ovulation method. This method is based on observation of changes in characteristics of cervical mucus. At the time of ovulation, the mucus becomes watery and clear, resembling raw egg white, or smooth or slippery and profuse. This is what the consistency of cervical mucus. After ovulation, under the influence of progesterone, makes the mucus thick and lessens in quantity. It is recommended that women uses a tissue paper to wipe the inside of vagina and to assess the quantity and characteristic of mucus. This is the one of the major tricky part. How many of the females will be ready to do this? Okay, and they should be able to differentiate the difference before and after. This requires very good degree of motivation than any other method. And in a countries like India, if the female does not accept it, it does not work, because still people think it is some taboo kind of thing to do all these things. Okay. The third method we have, that is symptothermic method. This method combines both temperature and cervical mucus and calendar techniques for identifying fertile period. Like Billings method is also used, cervical method is also used, and safe period technique is also used. All these work if the menstrual cycles are normal. If anovulatory cycles are happening, this does not work. Okay. But it is important, if all the three are combined, it can be double checked and interpretation can be done appropriately. Next, we have the last question for today, that is net reproductive rate. What does net reproductive rate mean? It is the average number of daughters, average number of daughters a woman would have. Women have average number of daughters. If she lived her life according to the age specific fertility and mortality rates of the given year, as per this year, if you are calculating the net reproductive date for this year, you will use the age specific fertility and mortality rates, that is 15 to 44 or 49 for that particular year. It includes mortality rates also, whereas total fertility rate does not include mortality rate. Okay. Why is it important? We'll see how is it calculated first. First is the average number of offsprings produced by female of different ages. That is age specific fertility rate. We have females and how many female kids are born as per the age. Later we have survival rate, means how many females will survive in the next age class, probability of survival. The formula used is R naught is sigma of Lx and Mx. What is Lx is probability of surviving to age, and Mx is the number of average female offspring produced by a female of age X, this particular age group. And it is done for all age groups. Okay. How is it inference is interpreted? If the NRR is 1, the population is stable. That each generation of mothers having exactly enough number of daughters to replace themselves. That means 100 females are existing. They give birth to 100 female children so that they give birth to 100 female children. Okay. If this comes to 80, this will come to 80. First generation, second generation, third generation. So there's a reduction in population. If it is less than 1, the population is decreasing. Okay. If 100 females are there, and if there are 150 females birth is happening in the specific age group, that means the population is NRR is 1.5 approximately. When you calculate it in a crude way, that means population is increasing. Equal to 1 stable, less than 1 decreasing, more than 1 increasing. Okay, let's see the example. Assume the population where 50% of the females survive to age 1 and have 1 daughter, and 25% of the females survive to age 2 and have 2 daughters. Okay, age 2 doesn't mean that 2 years or 3 years, it is a hypothetical one. Age means 15 after 1 year, that is 16, or 31 after 30, that is 1, age 1, have 1 daughter. Okay, 10% of the females survive to age 3, have 3 daughters. When they are all calculated, the average comes to 1.3. This means that 1.3 daughters over one female in her whole lifetime. That means the population is increasing. Okay, 1.3 daughter per female and 13 daughters per 10 females. Okay, this indicates that population is increasing. Okay, what is the importance of this? It helps in framing the policies at the national level and making the educational policies and the budget allocation or the resource allocation. Healthcare, it could be healthcare, it could be educational resource, it could be social resource, it could be financial resources. All these things are planned based on the all this thing. With this, we'll be completing today's class of demography and family planning. Thank you so much for watching, and please do get subscribed to Auricle. We have social media handles of YouTube, Instagram, Facebook, and Telegram. And you can subscribe in all the 4 channels. And please do download the apps on Google for Android users, and we have app on the iStore, App Store for the iOS users. Please do use the discount code for very good discounts. Thanks for watching. Please do subscribe.